Good morning, everyone. I'm pleased to join with you virtually, and I look forward to seeing you in person. The Leukemia and Lymphoma Society is here to support your patients and also to support you via phone, email, chat, and various online resources. Our information specialists, who are oncology social workers, nurses, and health educators, provide personalized assistance for dealing with financial and psychosocial issues, as well as managing treatment and side effects. We also offer free one-on-one nutrition consultation with our registered dietitian. Please think of LLS as an extension of your staff. And you can access the information at www.lls.org/support. Specifically for you, professional education webinars offer CE credit for social workers and nurses. And listening to our podcasts for healthcare professionals is a great way to get short segments of information in a conversational way, all on survivorship, treatment, and disease. You can access this information at www.lls.org/CE. On behalf of the Leukemia and Lymphoma Society, thank you to all of you, the oncology social workers, who support blood cancer patients and their families every day. And especially now during the COVID pandemic, you are needed and most appreciated. Today, I am pleased to present the award for the LLS Aosw Hematology Oncology Social Worker of the Year to Karen Bettner. Karen Bettner began her clinical social work career 31 years ago. When she joined Franciscan Health, Indiana Blood and Marrow Transplant 10 years ago, she was new to hematology, and she immediately began to learn about blood cancers, the intricacies of transplants and patients, their needs, and the various resources to support them. For the past 10 years, Karen has worked closely with LLS, actively referring patients for support and resources and getting her hospital staff as well as her patients involved with LLS. She organized a panel discussion for blood cancer survivors and was able to turn it into a quarterly support group. She was co-leader for the LLS Monthly Book Club for 10 years and is in the process of arranging a support group for allogeneic transplant survivors. She has also chaired her hospital's team for LLS's major fundraiser, Light the Night. As Karen's colleague wrote about her, Karen is able to rally staff, and when she has identified a need, she pitches in and she comes through for her patients and her families in need. She has taught me so many things over the past 10 years. And as we have worked together, I have become a better person. What a wonderful, wonderful opportunity it is to honor and recognize you, Karen, for all the things that you've done. Congratulations.
Thank you so much. I'm so honored to get this award. It was really a surprise. I do want to thank all the patients who I've worked with who keep me going, and my coworkers, especially Mary Miller, who's going to be starting this new support group with me. My family, my husband, who usually gets home before me with this job, and my daughters, who they just bring so much joy into our home.
Oh, nice. So tell me, Karen, what do you enjoy most in your role as a social worker?
I have always enjoyed the relationships with the patients that I have. Being with transplant area, I'm the only social worker, and I see the patients right at the beginning when they're coming in. A lot of them are very scared. They hear all these awful side effects. They're scared they're going to die. So I usually come in and get a lot of information, talk with them, try and ease their fears and give them a lot of resources. And I have that relationship the whole time we're together. I go inpatient and outpatient. So I follow them through inpatient, go visit them up in their rooms, pop in sometimes just have fun. Sometimes, it's a little more serious, follow them outpatient, find resources. And usually the relationship is very good, even through death. I mean, we've had some things that I've wondered before, do they blame us or anything with all that happens? But most of the time, I get calls afterwards asking questions, needing to talk a little bit. And then through survivorship, a lot of times talking to people, having them pop in, which is really fun, just seeing people as they continue out in the world again.
Thank you. Thanks for sharing that. So what do you feel most proud of as a social worker, and what do you hope to accomplish moving forward?
I really feel proud of my knowledge base because I started off, even though I've been a social worker for 31 years, hematology was totally foreign to me. So was cancer. I was used to working with head injury patients, and I worked other jobs too. So coming in here, I wasn't sure how I would do with this, and I just didn't have a lot of knowledge. So I used Aosw. Right when I started, I joined the SIG line and got a lot of information off the internet. And I didn't answer much, but I was a snooper and pulled off information from other people and put it together. And then as I started feeling more comfortable, I actually started answering some questions too. I also, hooked up with LSW right away and worked with them. And that's one of the things I'm most proud of, is my relationships with all these people and the support groups that I've done, because I've run into so many families that are so alone, and a lot of times the focus is on the patient. So I've supported the families and the patients and developed support groups, book club. And right now, what I'm really proud of, and thanks to technology, because we weren't able to do this before because a lot of our transplant patients really live far away. So I didn't see a way to do a support group unless we just had call-ins, which was kind of hard. So we're working right now in a virtual support group, working with LLS, Kristen Parker, and my coworker, Mary Miller, and we're going to develop a support group, probably roll it out this fall for transplant survivors. So that's one of the things I'm most proud of is starting that support group this year.
Thank you. Thank you. And we all know that's really needed. So I'm sure that'll be very supportive for patients. So thank you for sharing, Karen. This is congratulations again on your award, and all good things going forward. So I'm now pleased to turn this over to Karen DeMiro.